Okay, think about this. What if a hospital's main job wasn't just to fix you when you're broken, but to keep you from getting sick in the first place? It's a pretty radical idea, right? Today, we're going to explore this huge shift in healthcare, how we're moving from hospitals as these distant, isolated ivory towers to something completely different, lively community hubs. So, let's dive in.
So it all starts with this really simple sounding question, right? What is a hospital's real job? I mean, the obvious answer is, well, it's for treating sick people. Duh. But for decades, health leaders around the world have been saying, whoa, hold on. That view is not just incomplete, it's actually kind of dangerous. The real answer, as you'll see, is way more interesting, and it's changing, well, pretty much everything.
And this really gets to the heart of the whole debate. You've got these two totally different models. On one hand, you have the ivory tower of disease. Picture this imposing building, totally separate from the community, basically just sitting there, waiting for sick people to show up at its doors. But on the other hand, you have the community health hub. This is a hospital that's woven right into the fabric of the neighborhood, It's actively out there, working with people to keep them healthy.
The thing is, that old ivory tower model was just full of problems. I mean, these places were seen as super rigid, crazy expensive, and just completely disconnected from the actual people and cultures they were supposed to be serving. And what was the fundamental flaw? It's simple, really. They were built to treat diseases, not to care for people.
And let's just talk about the money for a second, because this is wild. In some countries, hospitals can swallow up a staggering 50 to 80% of the entire national health budget. Think about that. When one type of institution becomes a financial black hole like that, it just sucks all the resources away from everything else, especially the preventive stuff that could keep people out of the hospital in the first place.
So yeah, clearly something had to give. And this is what sparked what's called the primary health revolution. We're talking about a complete top-to-bottom rethinking of what healthcare is even for.
And what's interesting is, this isn't some brand new idea. We're talking as far back as 1957. The World Health Organization was already saying, hey, hospitals can't just be these isolated islands. They have to be part of a bigger system, one that connects prevention with treatment, and it all has to start right there in the community, with local health centers and clinics.
This quote from a Dr. Renee Sand really became the mantra for this whole new way of thinking. He said, the right patient should receive the right care at the right time in the right place at the right cost. It sounds so simple, but it's incredibly powerful, isn't it? It just completely flips the script. The focus isn't on the hospital anymore. It's on the person. It's not just about being efficient. It's about doing what's right and what's humane.
So what does this actually look like in the real world? Well, the hospital's job description gets a massive upgrade. It's not enough to just sit back and treat the diseases that happen to walk through the door. Nope. Now the hospital is also responsible for actively getting out there to prevent illness and promote good health for the entire community.
Okay, but to pull this off, doctors themselves had to learn a totally new skill. They had to learn how to shift their focus from diagnosing one single patient in front of them to diagnosing the health of an entire community.
This really changed what it means to be a doctor. I mean, of course, they're still a clinician, right? They're still treating individual patients, but now they're also a community health leader, looking out for the well-being of thousands of people. And they're a teacher, helping people understand how to take charge of their own health, which makes sense, The word doctor actually comes from the Latin word for to teach. Pretty cool.
And the number one tool for this new job is something called a community diagnosis. The best way to think about it is like being a public health detective. The goal isn't just to find out who is sick, it's to figure out why they're sick. You're looking for patterns. You're asking what's going on in the environment and the economy and society that's making people ill. So how do they actually do this? Well, it all comes down to data. They're looking at things like the age and gender of the population. They're tracking vital stats, birth rates, death rates, and they're measuring the big diseases, looking at both the number of new cases popping up, that's the incidence, and the total number of people who have it right now, that's the prevalence. It's basically medical detective work, but on a huge scale.
Here's the simplest way to think about it, and I love this analogy. It's like a checkup, but for an entire town. You're doing a complete physical exam and taking a full health history, not for one person, but for a whole city.
But, okay, if you're going to diagnose an entire community, and especially if you want to compare your findings with other communities around the globe, you're going to need one really important thing. You need a common language, a universal system, so that everyone is classifying diseases in the exact same way.
And people have been trying to create this universal health language for centuries. Seriously. It started with just simple lists of diseases, way back in the 1600s. But the real game changer came in 1948. That's when the WHO said, okay, we need to track not just what people are dying from, but everything that's making them sick, what's called morbidity. And all that work eventually led to the global standard we all use today, the ICD-10.
So let's take a quick peek under the hood of this thing. The International Classification of Diseases, the ICD, it's basically organized into 21 big chapters. Each one gets a letter, and each letter covers a different category of health stuff. Everything from infectious diseases to mental health to injuries. It's this massive, incredibly detailed catalog of pretty much everything that can happen to the human body.
But here's what's really fascinating. The ICD isn't just about diseases. It also tracks the other stuff, the factors that influence our health. Check out these so-called Z codes. They let a doctor officially note things like tobacco use, a lack of exercise, or an unhealthy diet. And this is huge. It gives public health officials a concrete way to track the root causes of illness, which is exactly what that whole community diagnosis thing is trying to find.
So in the end, this universal language is the glue that holds this whole idea together. It makes sure that a doctor in Tokyo and a public health researcher in Toronto are speaking the exact same language when they talk about health. And that consistency, that's what makes worldwide prevention efforts, managing health systems, and doing critical research even possible.
And that brings it all right back home to you. Think about the journey we just took, from the giant macro idea of a hospital's role, all the way down to a single, tiny code for a personal lifestyle choice. So now that you know how the experts go about diagnosing the health of an entire population, it makes you wonder, doesn't it? What's the health of your community?